It's a code cart, not a supply cart.
This is Stepping Up Healthcare. Your host is Tack, and the mission is simple. Build your capability and curiosity to make healthcare better.
All right, welcome back. Today we're talking about inventory waste. That's the I in our downtime acronym. The classroom definition of inventory waste is having more than you need earlier than you need it. Now, you might be saying that sounds awfully familiar to overproduction, doing more than needed, earlier than needed, faster than needed. And you're right. The key difference in my mind, though, is that overproduction is an action. You are doing more than needed. Inventory is a physical item, having more than you need. Hopefully, if you've been listening to these episodes around the 8 wastes, you're seeing these interconnections between them. Rarely will you find something that is just one of the 8 wastes. Back to the topic at hand, inventory. In healthcare, inventory often feels like safety. Extra supplies, extra meds, extra equipment. Once again, those dreaded words, just in case. Now, sometimes, the extra really is necessary. Inventory becomes waste when it expires, gets lost, takes effort to manage, or hides problems in the system. We'll talk about this a little bit later in the episode, but the goal isn't zero inventory. It's about having the right amount, in the right place, at the right time.
Why does it matter?
We're going to be talking about multiple reasons, but the major overarching reason is that excessive inventory doesn't just sit there. So our first reason why it matters is that it takes up space. As simple as that. We literally need physical space to store it all. Think about your pantry. If it's completely full, where does your excess go? Is it on the counter? Is it on the table? Does it just go wherever? At work, when a new or alternate supply is introduced and you have to find a place to store it in the clean hold, that can be tough, especially if it's completely packed with all of these supplies. The second reason is it requires extra work or complicates the system. That means that staff spend more time searching for specific supplies amongst all of the supplies. Or they end up spending time rotating stock or removing expired items. And lastly, if it gets really bad, they have to work around the clutter, and then there's a potential for employee injury, which hopefully isn't the case in most places. Lastly, you probably were expecting this one at this point. It often masks deeper process issues. When inventory is high, we stop asking, how much do we really need? Or, why don't we trust the system to deliver? To be clear, this isn't dumping on supply chain or materials management. This is why don't we trust the system, those processes? Why don't we trust them to provide what we need when we need it? We don't want to be in the middle of a code and then be like, where's the ambu bag? We need to be able to trust the system to provide what we need when we need it.
Let's talk about some real-world examples.
Most obvious one, and one we've been kind of talking about in this episode, is supply rooms. If shelves are packed so tightly that nothing has a clear home, that's inventory waste. If the safest move feels like hoarding supplies in drawers, carts, or the charge nurse station, because you never know, that's inventory waste. A real example I've witnessed was with a dental clinic. I got pulled in to help them improve some of their processes and identify some of their gaps. Now, it was a pretty small operation. The folks there worked 5 days a week, but only had about 10 cases per day, so about 50 cases in a week. If you extrapolate that out, about 250 cases per month, give or take. They had their supplies on auto order, so they got a certain amount of supplies every single month, delivered to them quick, easy, no one had to think about it. So when we went into their supply room was absolutely packed. I mean, had supplies everywhere. Looking at a box of saliva ejectors, they came in boxes of 1,000. Now, this auto reorder had been happening for several months, and we found 31,000 saliva ejectors. Now, 1,000 of those are coming every month, but they're only doing 250 cases every month. So that backlog of just supplies, just specifically around the saliva ejectors, was insane. Now, off the top of my head, I can't think of if they technically expire, but think about all that waste if all of those start to expire. They've paid for those, and they've been taking up space in the supply room, which once again was a complete disaster of an area. One more example, one that I've personally dealt with. Doctors with different trays for the same procedure. I get that there is a preference between people on what they like to use and what they don't like to use. Low-risk example is ask someone who's a DIY person. Do you prefer Milwaukee, DeWalt, or Ryobi drill? And you'll get some really strong feelings and really strong opinions about it. But the more customization we have from tray to tray, the more complex it is for our folks in SPD to clean, reassemble, make sure that everything is correct for this specific doctor. And for the surgical techs to make sure that everything is there for when the case is being set up for that specific doctor. One last thing, something to ponder. Think about data. We are usually swimming through data in healthcare. If the data isn't informing any change of action, then that's waste too. And you could argue that it's inventory waste. It takes up space in our servers. It takes up space on our computers. Just something to think about. I want to talk to you about a time that I 5S'd an area. That's the number 5 and the letter S. 5S. We'll talk about 5S in depth later, but essentially, 5S is about cleaning your work area, organizing it smartly, and keeping it in a way that runs smoothly. Part of that, as stated, is organizing your area smartly, which often leads itself to looking at inventory waste. I was charged with working with a team to look at code carts in a hospital I used to work at. We were looking at how the carts flowed and how they were restocked. But we also ended up doing a small 5S project on each of the carts and the contents in the cart. We ended up going item by item, looking at the par levels. We would ask, do we need 8 3 milliliter NS syringes in a code situation? No, I think we can just have 4, and if we do need more, we can have a runner go to the clean hold and get it. Now that's a small example of change, but afterwards, we had removed collectively 72 items from the cart. Keeping in mind that 1 syringe equals 1 item, 1 ammo bag also equals 1 item, and so on and so forth. But that really decluttered the carts, and we ended up finding a cost avoidance of $1,400 per cart. That's amazing. Not to mention, we were able to simplify how things were laid out in the cart as well. But the reason we got here is because we didn't trust the system and disguised it as just in case or for safety reasons. I'm going to end up just dumping a bunch of supplies in the cart. But how we got away from this was going through each item. But also we aligned on the purpose of the cart and the items within it, which was huge. Why do we have this cart? What is the purpose of this cart? We actually ended up adopting a mantra. It's a code cart, not a supply cart. And that was our guiding principle as we did this work. There's the trap of inventory waste. Too little inventory creates fear. too much inventory creates friction, complication, and waste. Improvement isn't about swinging between the extremes. It's about finding that correct amount. High inventory generally tells us replenishment isn't reliable. Now, this could be because of a global supply chain challenge or a local supply chain challenge. It can also tell us that demand isn't understood. What is the appropriate par level? Or are there even par levels to begin with? And lastly, high inventory often tells us that there are communication issues. Is it that the departments are having trouble communicating effectively? Or maybe the supply chain software isn't as easy to use as we think.
Homework time!
All right, so we've got homework again this week. I want you to pick a couple of supplies. Don't reorganize them, don't clean it up or anything like that. But ask yourself, what items are touched every day? You might be able to answer this without even looking, but still, pick those supplies and ask these questions. Number 2, what items are rarely used? And lastly, what items are duplicated, quote, just in case? That's all I've got for you today. Next episode is about motion waste. I'm Tack. You're appreciated. Let's step up healthcare.